I'm Barry Borman. I'm the chair of FONS. And before we go any further, I'll ask Tim to do our karakia, then I'll introduce the two speakers.
Thanks, Barry. Kia koutou katoa. Kia tātou. Whakaronga rā I rongo. Kia mātou rāpu mātai. Haora apora Aotearoa. I manawai ni. Kia ti rongo wai. Teki. Ti whaia. Ti rawi ti whaia I nuku. Whaia I rangi. I taki mai I kahu e ngā araki. Kia turu, kia whakamau, kia tina. Huie, taikie. Thanks, Barry.
Thanks, Tim. It gives me great pleasure to introduce our two speakers today. It's Professor Peter Crampton, I'm sure is known to many of you. He's a professor of public health at Otago University, has a huge involvement in public health in many areas for a long period of time. And our other speaker is Dr. Claire Mills. Beverly Tahira, who was previously going to do it, has been inadvertently detained by a bunch of auditors, I understand, and so Dr. Claire Mills is a public health medicine specialist currently working in the Secretariat of the Public Health Advisory Committee. Again, Claire has a long and distinguished career in public health in New Zealand, made contributions to many areas. So thank you to both of you for taking the time out of your busy schedules to give the webinar today. So I'll turn it over to Peter.
Kia ora koutou katoa. Thank you very much, Barry. It's a real pleasure to be here with you all. Thank you for coming and attending this on this lunchtime. Ko waio no ingarangi me airana o kutupuna I whana mai au I ingarangi I te puaki au I ingarangi me whakatū, no reira he Pākehā hau. Kei o tākau whakaihu waka ko te wharewananga o tākau ahau e mahi ana o Peter Crampton tōku ingoa. Tēnā koutou, o te rā tēnā tātou. Thank you again for the invitation, Barry. With me is Claire Mills. As you said, Claire is the head of the Secretariat of the Public Health Advisory Commission. I'll just say a word or two about the committee in a moment so that everyone is aware of what it does. Now, look, a caveat here. There's a vast amount of material in the Determining Our Future report. I do hope that between us, Claire and I will be able to do it justice. We're just going to dip into aspects of the report, hopefully pique your interest. And hopefully, I mean, my main objective here, Barry, is for us to construct a little bit of a narrative through this that allows us to engage and use the report as a resource document. I have another hard I have a hard end of this on the hour at 1 o'clock. So we will be, well, at least I will be finished in 1 hour. I hope to present for about 20 to maximum 25 minutes, leaving hopefully a great deal of time for discussion and questions and debate. Just put my mouse in the right place. I want to acknowledge the very large cast of players who contributed to the Determining Our Future report. In particular, our key informants, the reviewers, and the immense amount of work done by the Secretariat and also other colleagues in the Ministry of Health and other government departments, but particularly the work of the Secretariat of the committee. We reviewed a great deal of input from recent workshops, Hui and Talanoa, that informed the development of various health sector policies and strategies. So we drew on that intelligence in writing the report. We also engaged with the Hive, which is a collaboration that supported youth voice and perspectives on government services. So our really grateful acknowledgements to all those groups, individuals and colleagues. The Public Health Advisory Committee is a statutory committee established under the Pae Ora Healthy Futures legislation, which is about to become the Healthy Futures Pae Ora legislation in the amendments that Minister Brown is making to the Pae Ora Healthy Futures Act. It's an independent committee that is public-facing. It provides evidence-based public health advice to ministers, the Public Health Agency, and Te Whatu Ora. I'm one of 7 members of the committee, and for 5 of us, just to note, our first 3-year terms are coming up for renewal in November. So all going well. I'll cover off some or all of what's there in the outline, starting with the whakapapa of this report. And the whakapapa is very, very important in this instance. This report builds on a long history of reports and publishing on determinants of health. Talk a little bit about the structure, what progress are we making towards equity, or have we made over the last 28 years? What are the new challenges that have emerged over that period of time? What evidence is there related to what works? And then our recommendations. And the report is obtainable on the Ministry of Health website. Ka pai. Okay. I want to start by conceptualizing public health and its relationship to the determinants of health. To state the obvious, perhaps, public health is intimately interested in the determinants of health. They are the foundation and the building blocks of our health, and they include such things as income, employment, housing, social cohesion, and so on. To my mind, the determinants of health represent the long-term, slow-moving, social, economic, and increasingly environmental forces that shape health outcomes. Long-term, slow-moving. These forces themselves are, to some great extent, the product of countless policy decisions made over the course of decades. And it is the cumulative effect of those countless policy decisions that shape and drive those forces, the determinants of health. Now, in our report, we use the metaphor of the forest of Tāne Mahuta, the biodiversity and complex systems, just like our society. And in this metaphorical representation, the tōtara tree represents the person and the whānau, person and whānau health and well-being. The leaves and fruit are expressing health and well-being outcomes. The soil provides key resources for well-being and health of the tōtara and the forest. And just as soil nourishes trees, people thrive when they have access to essential resources such as secure housing, nutritious food, and so on. And just as an aside, the Public Health Advisory Committee's previous report was on the food environment for Aotearoa. The roots in this metaphorical representation are the relationships between whānau and community. The trees gain strength from their roots, and similarly strong relationships and meaningful connections provide people with stability and resilience. The bedrock which underlies all of that represents the human rights, te tiriti o Waitangi, in other words, our constitutional arrangements in Aotearoa, and also the right to health. These are the fundamental foundations of our well-being. There are also other fundamental structures which belong in the bedrock, such as economic and justice systems. And the bedrock is not necessarily uniformly positive. There are negative influences within the bedrock that can have detrimental effects for health and well-being. Discrimination, racism, the ongoing impacts of settler colonialism, and our current type of economic system are some of the structural forces or issues in the bedrock which generate unequal access to the soil that lies above and the resources for health and well-being. Can we influence the policy decisions that shape the long-term, slow-moving forces that determine our health? Yes, we can. We, the committee, feel very positive about that. And the purpose of this report is to provide a summary of the knowledge base that we require as a society to understand the forces that shape our health and equity, and to provide guidance as to the most important policy levers and approaches if we are serious about determining our future health in a way that benefits everybody and reduces health inequities. The purpose of this presentation is just to dip into some aspects of the information in the report and to follow the logic through to our recommendations. I'm not going to go through this in any detail, but just to say this report builds on a strong whakapapa, as I said before. And I want to just highlight the beginning and the end of that whakapapa, starting with the 1998 report of what was then called the National Health Committee, which was a forerunner of the current Public Health Advisory Committee. The social, cultural and economic determinants of health in New Zealand, action to improve health. That was a highly influential report. This report that we're talking about today updates that 1998 report, and it's coincidentally somewhat being published in the same year as the very important World Health Organization report, World Report on Social Determinants of Health Equity. Right, so there is an important whakapapa, and it's worth exploring. It's a very rich and important whakapapa. The report itself consists of 6 sections. Each can stand alone. Each can be dipped into and used as a resource. I don't think it's ever been our intention that people sit down and read the whole thing from beginning to end. It's not a report that is designed to be engaged with in that way. And just one further point here. Pop-ups occur throughout the electronic version of the report, and they occur on the second click on any given page, as demonstrated there. Right, now I'm going to move on to some substance. Why are determinants distributed unevenly? And how do they get under our skin? So coming back to the bedrock, discrimination, racism, and ongoing impacts of settler colonialism or settler colonization have negative impacts on society and create unequal access to the soil. In section 2 of the report, we discuss some of the negative bedrock elements and also outline our current understanding of the biological, physiological, and epigenetic mechanisms that drive poor health outcomes under the skin, as it were. Those poor health outcomes that result from negative exposures, including the importance of early childhood development and so on. What progress have we been making over the last 28 years towards equity of the distribution of the determinants of health? We selected indicators that align with existing international and New Zealand monitoring frameworks for equity. And we aim to look at long-term trends in some of the key determinants. We were limited to using publicly available data because of time and resource constraints. Where possible, we disaggregated by ethnicity, socioeconomic position, disability, and gender. And to summarize this whole section, we found mixed trends, largely a persistence of inequities by ethnicity and socioeconomic deprivation. And I'm just going to turn to a couple of examples here to illustrate that point. Let's start with education And here we can see that school attendance and educational attainment both show persistent inequities by ethnicity. And that's been unchanged for decades. Negative trends since 2015 for school attendance were exacerbated by COVID-19 and are still below pre-pandemic levels. Noting also that NCEA, which was introduced in between 2002 and 2004, was associated with increasing success for all groups up until COVID. But there are still persistent inequities. Unemployment, another key indicator, and it's important because it's a driver, forward again, a driver of equity and inequity between Māori, for Māori, and Pacific people, and young people in particular. Between 2008 and 2024, annual unemployment rates for Māori and Pacific people have remained approximately 2 to 3 times that of European New Zealanders. And the rates are increasing again since 2022. And there are particularly high rates of unemployment for young Māori and young Pacific people. Absolutely crucial indicator. I'm just going to flick through to one more indicator in the interest of time, but you can see some of the material there that is included in more detail in the report. Let's just touch on household crowding. Now, this bar graph shows counts, numbers of people, not rates, and the number of people living in crowded houses has increased for all ethnic groups. For all ethnic groups, with Māori and Pacific being disproportionately affected. Oh, I will include a comment on child poverty as well. And I'm including this because it shows success. The overall picture shows significant absolute reductions for all ethnic groups. And this arose from the initial bipartisan commitment to reducing child poverty. And it tells us that policy changes can make a difference quite quickly. We should not be nihilistic about the determinants of health. They are in our control. They are the product, as I said, of many, many policy decisions made over years and decades. And those decisions are made by us as a society, and we can make different sorts of decisions. And as we see from this chart, we can be successful in that. So the summary there is mixed trends. Some successes, some stasis, and some worsening. To use Claire's metaphor here, railway tracks, parallel trajectories by ethnicity, with gaps remaining relatively constant for Māori and non-Māori, and for Pacific and non-Pacific. All right, next set of graphs before I wrap up is on health outcomes. And I'm only going to show a couple, but let's just start with life expectancy. And what this graph shows is exactly what I just said. The gap persisted over the last 25-year period, but has narrowed for Māori compared with non-Māori, non-Pacific. And in fact, the life expectancy for Māori increased faster than for other ethnic groups over that period of time. But the gap for Pacific peoples has widened. So it's a mixed picture with that graph. just to end this part on another positive note, smoking is a public health success story, or has been up to now. We have a government which has got a very substantially different view towards tobacco than previous governments. But the trends over the past 2.5 decades have been positive. Rates have more than halved for all ethnic groups. And there was around a 25 percentage point drop for Māori. This has plateaued over the last 2 years. And I and others obviously are feeling some anxiety about that. And of course, the inequities are persistent despite the absolute reductions for all groups. So again, to summarize the trends, some improvement, some deterioration, and some stasis. So a mixed picture, but with some notable successes. Looking to the contemporary situation and to the future, Section 4 of the report talks about the so-called megatrends, and in particular, the emergence of AI and the climate crisis, which was talked about but wasn't a reality back in 1998. Now it is very much a reality in our lives. These megatrends, it is predicted, will have very large impacts on all aspects of our lives and, of course, on the determinants of health. In the report, we look at what has been shown to work, looking at the evidence from Aotearoa and around the world, and we highlight and describe that evidence. And we go on to make recommendations that we feel are the most important actions that government can take to rectify the negative trends in some of the determinants of health and to help secure a healthy and equitable future for all communities. And they fall into 3 broad areas: investing and empowering communities. That's a root network in the metaphor, in the forest of Tāne Mahuta. Nurturing the bedrock, Te Tiriti Waitangi, full commitment to human rights, and a more equitable economy that serves the needs of people rather than vice versa. And a focus on win-win solutions in the face of those mega trends that I mentioned just before. So that's a summary of our recommendations. I've got more detail here. I'm going to stop talking in just a moment, so I'm not going to go into any depth here, but just to say, investing in communities, nurturing the bedrock, and those win-win solutions. Also, we made some high-level recommendations for the health system because the health system itself is a determinant of health. And also, it's a key influencer because it's such a big employer and such a big part of all our communities. So, look, to wrap up this part, let me just say that for me personally, there's been something of an experience of time travel in engaging with this work. To my mind, the National Health Committee's important report in 1998 gives us really good insights into the state of play 27 years ago. In the intervening time, we've seen some positive changes in health determinants, some negative changes, some stasis, and the emergence of new powerful determinants. And in the case of AI, it was hardly imagined back 27 years ago, other than in science fiction. And of course, climate change is a current reality for all countries in the world. To reiterate my earlier point, can we influence policy decisions that shape the long-term, slow-moving forces that determine our health? Yes, we can. we can do that. And we have evidence in the report that we can be very effective in influencing those policy decisions and shaping a future which is healthy and equitable. The report provides a summary of the knowledge base we require to understand the forces that shape our health and the equity of health outcomes. And it provides guidance that you can dip into and use as a resource. I hope that everyone feels better equipped to engage in conversations about and around determinants of health. And I hope that the report resources those conversations in a way that is helpful. Once again, Barry, thank you very much for the opportunity to speak today. Thank you, everyone, for being here. I've left plenty of time for us to engage in discussion, and I'm going to stop sharing right now so I can see faces, but I can share again if that is necessary. So, kia ora mai tātou katoa.
Thank you, Peter. Excellent presentation, and opportunities for discussion from the audience. Claire, is there anything that you'd like to add to the discussion so far?
Oh, kia ora koutou. Perhaps just to say that, yes, I think just to reiterate what Peter's saying about the importance of being optimistic about policy change and changes to our basic kind of structures, because we have seen some other, really important issues like the reduction in incarceration of young people, particularly young Māori. And that's obviously associated with other things like the reduction of children in state care. So there are important things that have been happening that will have an influence into the future. And in a similar way to the way that a reduction in smoking rates will have an ongoing flow-on effect for the next 20, 30, 40 years, the experience of keeping people out of prison is also a very important one. I think as well we're calling for things that in the current political climate are probably not seeming very feasible, but I think things like thinking as we go towards the 200th year of this partnership that we have in our country under Te Tiriti is a really important thing. And it doesn't really matter what political stripe people are. It is something I think that we all need to consider as citizens of this country. There has been quite a bit of work done on that, particularly by Māori with Mātiki Mai and the numerous hui and discussions and kōrero that have been around that. So I think that although some people might think that some of the recommendations are perhaps not realistic right now, I think that there's also good evidence that these things can change, again, quite quickly if we choose to make them happen.
Thank you, Claire. And if anybody does have a question for Peter or Claire, you can use the chat or raise your hand. If you were the Tsar, Peter or Claire, and you produced the report, and so what? What would you like happen? I mean, one of the issues often happens is that these wonderful reports get produced and there they stay. So, you've proposed various things, but what would be, the deal breaker from now, considering the environment we're in and all the issues to do with the health sector? What would, what's next? What's the next steps? I mean, you've said that this sort of information can influence policy. That's great, but how would you like the next steps to be?
Claire, shall I have a crack at that, and then you can put us right? Look, Barry, my answer to that is that the report identifies the need for joined up across government action that is specifically directed towards health and well-being for all communities. And that requires coordination and a different way of working across government, not substantially different, but different, aiming towards health and well-being goals for all communities. It also requires accountability and monitoring mechanisms to ensure that is achieved. In other words, a framework for policy making that is directed towards health and well-being of people. Claire, what are your thoughts?
I think for me, in a more sort of pragmatic way, I think housing is one of the big things. We know a lot about it. We know the importance of it. We know that there's some really good stuff happening in terms of Māori housing, in terms of better housing for intergenerational whānau, better housing for people with disabilities. These things can happen. We know that actually Pae Ora was able to ramp up to the level of housing build that was needed, and that's been a deliberate decision to stop it. But we do have also community housing providers that are capable, but not at the scale that we need. So I still think, given the health and wellbeing implications of secure, good quality housing, that is something that we could try and get a more bipartisan approach to. I think it's difficult with this current government, but not impossible. I think as well that what Peter said about the more joined up way of working is really important, because we see this in the health sector, particularly in primary care and community services as well, the sort of fragmentation of contracting, of provision of services for the same whānau. And I think that that's something that needs greater direction and leadership from the top. And I guess in a way, the social investment agency kind of model is a kind of a way of trying to do that. But of course, that's very targeted at whānau with complex needs. And I think we actually need to be thinking, how do we get government services to work locally and regionally in particular with a much more joined up approach.
Thanks, Claire.
So I think that's a longer term process, but it's an important one.
Thanks, Claire. Vanessa has said for her the next steps would be more disability data. What do you think about that?
Yeah, we had limited time and resources to bring together all the data, and it is surprising to me how difficult it is to find publicly available good quality data, especially over a longer time frame. Most government departments, leave it for about 5 years on the website and then it disappears. And certainly there's only quite limited good quality data for disability. But even disaggregation by DEP and ethnicity is sometimes quite poorly done. So I think data quality is a big issue, and I think this is something that's really important for the disability community, but also, for example, when we're looking at things like the increasing use of AI, and which is going to be built off big data sets, which need to reflect our population and the different groups in our population. So, yeah, it's an issue for sure, and not just the quality of the data, but the analytical intelligence around how the data is used.
Thanks, Claire. Now, here's a very good question. I don't know whether you've both seen it in the chat, but I should remind everybody, FONS is actually apolitical. But the question is, in the current political environment, which determinants of health are worth pursuing with the current coalition government? I assume they're off the table from Phil. You already mentioned housing, Claire, but I think that's a very provocative question.
Well, I think I would say under any government, all determinants of health are worth pursuing because, I mean, we're beyond the political considerations, but I certainly think that, and I think from a public service point of view, public servants are there to provide good evidence, free and frank advice. And we know that, for example, if we're looking at things like commercial determinants of health, this is a very sensitive issue with the current government. But I think it's still important because if we're looking at what are cost-effective, equitable ways of improving health, we should not be leaving things off the table because they're not in agreement with the current political ideology. I mean, I think that's our job to still make that clear, both publicly and to, when we work in a public sphere, but also within government.
Barry, I might just add to that because it's a very important question and a very difficult one. Probably for all of the people here, and I see there's 108 in the Zoom call, there will be opportunities presented to us in our work, and we're going to have to be fairly nimble to take those opportunities in influencing determinants of health, particularly at local and community levels. I think it's a little bit hard to identify areas which are clearly going to be priorities for the government. I was going to suggest unemployment, but even that is made complex by changes to the pay equity legislation and so on and so forth. So I really mean high quality, fair paid employment. This is a highly complex and nuanced context within which we work. But still, I would maintain all of us will, from time to time, be faced with opportunities, and we should take them to influence positively the determinants of health at whatever level of society, communities, or whatever we're working in.
Thanks, Peter. Boyd, lovely to have you along. He's got a question for you both. Does the government need to respond to the report, and if so, in what time frame? I note with the last report, Minister Retty dismissed it without a response. I hope this is not true for this one.
I spotted in the Public Health Communications Centre report on this report the comment that in 1998, when the National Health Committee's I think seminal report was published on the determinants of health, the then Minister of Health, the Right Honourable Bill English, dismissed it as old news. Fast forward 27 years, and the question I think, Boyd, is let me go to your question actually in the chat. Does the government have to respond, or does it need to? I'm going to read that as have to. No, it's the prerogative of the government about whether or not how and whether or not it responds. And there's no time frame. So there's nothing in legislation or otherwise which obliges government to respond. And Claire, you can fill us in with what response we have had so far from a secretariat point of view.
I think there's been interest across the ministry and the health sector, but we have not had great encouragement to communicate it internally by the DG.
Okay. Debbie Edwards has got a question. Influencing determinants definitely relies on cross-agency collaboration nationally, regionally, locally, but mostly this has not been something the health sector has invested enough in. How could this be given more priority? That is the very thing that I think both of you mentioned about cross-agency collaboration.
Claire, over to you for an initial response to that one. It's a great question.
I'm just sort of reflecting on some of the current sort of circumstances and also some of the discussions we had with the key stakeholders and informants and people that we interviewed, for example, from the wellbeing boards or from iwi and so on. I think it does require some direction from the top. And that obviously is difficult if we're being told to stick in our lane and not collaborate. I think I think sometimes we have to think of ways to get around the prevailing direction. I think it could be. I think it can also be something where, I think one of the pressures on the health system is resources and costing and workforce, obviously all coming together in a rather nasty kind of pattern at the moment. And I think that is one of the reasons why people are focused inwards and not collaborating so effectively. But I think, again, this is something that needs to be a sort of government priority, and we've got mechanisms, under the Public Service Act and other things that can actually support that kind of collaboration. I think also, and Kevin referred to this when he spoke about the report to the college last week, that, we talk about things like health and all policies, and rather than us thinking, we want you guys to do something to help us, maybe we need to be thinking more about actually how do we support agencies to also achieve their goals. And this is something we talk about in the kind of win-win solutions to things like the climate crisis, that actually things that support climate goals, such as better public transport, better quality, well-built housing, reducing emissions, they're also obviously going to be really great for public health, or the population health, if we do it well, and tend to be pro-equity. So I think that those are the kind of things we need to be thinking about, that it's not just about how we can get better health outcomes by getting other people to work with us, but actually how can we work in a way that actually meets some of these cross-sectoral, all of society wellbeing goals.
Thank you, Claire. My limited experience of a whole of government approach always boiled down to who was responsible for what. And so if it's a health issue, health was, but if you like, the determinants were housing, it became the housing area. And I think that was part of it, was never joined up about it's a health issue because it's the outcome, but the determinants are somebody else's concern, and that never seemed to work. So anyway, another question you've probably seen in there is cross-agency collaboration is also made more difficult if one is encouraging contracting out of service delivery to private providers.
Yes, I agree. And that makes me think of political economy and how power is exercised and whose interests are being served by the machinery of government and by the decisions that are made and policies that are developed. That certainly is.
Good, thank you. Marie Brown has said the report has some great specific recommendations, which I think we'll all agree with, about mandating cross-sectoral work to achieve measurable goals. Have you had the opportunity to talk to the Public Service Commissioner about how the Public Service Act could be used more effectively to achieve cross-government, cross-sectorial goals?
I think that's a really good suggestion. I will discuss it with the PHAC. We haven't done it so far.
I agree. I think it's a very good suggestion.
It's got to come from somewhere, though, doesn't it, Peter and Claire? Somebody at the top has got to basically bash heads together and say, we've got a problem to fix, and how do we do it?
Yeah, look, I agree. And I agree with Claire's first comment that this needs to be driven from the top. It's a cultural setting, but it's also a set of operational settings. with accountabilities and so on attached. So it works proper cross-agency collaboration is an undertaking that is complex and needs really serious effort. And that has to be driven by the top in the first instance.
At a slightly sort of perhaps subversive level, I think also that some of the views of the informants were, like central government is, and I think this also reflects in some ways the kind of swings between decentralisation and centralisation that we see in government. But there was also a call for trusting communities and iwi and hapu to be more autonomous and to work on the things that they knew that they could achieve and wanted to achieve, and for government to sort of get out of the way. And I think that in a period when perhaps it's more difficult to work at higher levels of intersectoral policy work, it may be a time where investing in building community capacity and working at the community level is actually a way that's still that we can still move forward in terms of public health. Obviously, it depends where you work, but I think that we can't underestimate the importance of building community capacity and whānau capacity to actually improve health. I mean, we're not going to wait around for Wellington to fix things, right? So I think that's a really important thing that does come through also from the key informants that we spoke with.
Peter and Claire, you're both public health experts. How do you manage this is a very public health report. How do you get traction on that when there's a great focus on hospital services, workforce, and so on? How does public health fit into, we see a lot of money going into hospital services and that's not enough. How do we actually get the focus onto this report in view of that environment that we've got, which is very loaded, I would say, at tertiary hospital services?
I might have a crack at that. It's a great question. Of course, it speaks to one of the abiding challenges faced by public health. What I would say, Barry, is that public health's current weakness, in my view, and its potential great strength lies in the relationships it forms with the people and communities it states are its top priority. And it is through the strength of those relationships that public health can gain traction at the community level, at the local level, at the regional level, and be driven. Let me restate that first bit again. Relationships with those whānau communities, hapori, etc., that we in public health claim to be the priority of our work, have tended to be weak, and they got much, much weaker during COVID. If we worked on those relationships, shored them up, strengthened them, made them real, and I know there are a lot of real relationships out there, but they need to be stronger, more systematically, then public health can be more effective and can counter some of the hospital-focused, service delivery-focused narratives that dominate our thinking. Claire, what do you think?
Yes, I think I'd agree with you around that. I think I definitely think that in public health, our ability to influence is our sort of superpower normally, because we don't have the resources or numbers or the sort of wow factor. And if we're doing really well, things don't happen rather than do happen. But I'm sort of I'm tempted to think that the sort of I mean, obviously the COVID pandemic was an exceptional event and has coloured the way a lot of people probably think about public health now. But I think, maybe Kennedy's doing us a favour by showing that, actually these things sometimes do change politically, and that I think we have to hold the line really as well, that actually we our strength is in relationships and in intel, if you like, and what we understand about whether it's Mataranga Māori or really good epidemiology or the sort of the qualitative stuff we know from our community connections. I think that should be what we're trying to bring together still. And I note Chris's comment or question in the chat as well. I think we had some really interesting conversations with Paparangi, but also Emma about Indigenous determinants of health and the kind of thinking around that. And we also tried to look at, well, how would you kind of measure that? And we don't have good sort of ways of measuring that in sort of traditional statistical or epidemiological ways. But I think that certainly our focus as well on the need to look at the way our society is set up from the bedrock, and this recommendation for action around how we should move forward on our partnership as a nation, I think is part of that response as well, that we have to have that capacity to have a rational, respectful conversation, and to understand that as Indigenous people, Māori will want to make their own path, and that is fine. It's not a threat to everyone if Māori wellbeing is improved. So I guess I haven't answered that one very well, Chris, but we definitely talked a lot about it, and I think it's a really important way of understanding determinants as well, because I think a lot of people from traditional public health would probably think more about equity and ethnicity and things like that. Whereas I think when you're thinking about indigeneity being a determinant, that can be framed in such a more positive way that's much more health enhancing.
Chris, have you got a follow-up question, Chris? Would you like to make a follow-up statement?
What comment?
You trying to draw me in there, what? Well, okay, kia ora. Thank you, Claire. Peter, oh, gee. I mean, this is awesome to be here and to see the energy that's committed to this kaupapa. Mihi atu kia koutou. When you talk of the tree, beautiful concept, way to see the world, but organised effort of society, I'll go and talk to the tree and work with the tree. He's part of my society to figure out what the solution is. And so I'm kind of, flipping out the gate here into a different worldview, but my idea of flourishing isn't just trying to catch up with some race car that's not running the race I want to win. So it's like I'm on a different track. But Indigenous peeps doing their own things, one thing, but Indigenous peeps working in kotahitanga is another thing for the world. And that's the vision. That's the not so that they can go off and do their own thing, which of course they do, because people like their racetracks. But there's so much more richness to work together on something that's going to help resolve some of these unanswerable questions. So kia kaha tātou is all I can say. And keep holding space for those energies to flow in.
Yeah, and I think, I mean, for me, when I think back 25, 28 years, I mean, things have moved so much. And when I see rangatahi and young people and what they're doing at the moment. I just think, wow, so there's lots of reasons to be optimistic because our demography is also changing a lot. I think, yeah, it's unstoppable, I'd say.
And that's the view I choose to hold as well, that demography, and in partly in response to your question, Chris, the one in the chat, demography will drive a lot of what we want to see driven.
Any other questions for Peter and Claire? If you want to, rather than type them out, if you want to speak directly to either of them, please raise your hand and Patrick can give you, turn the mic on. Erin Powell is just, Erin, would you like to talk to
Written a
that?
letter.
No, I'm not sure my sound's very good at the moment, so I probably won't talk to it for much. Just I guess talking a lot of the comments here that a lot of these social determinants drive a lot of our government health targets, and if we can communicate this, then we may be in a better position to get the resources in order to influence them, because we know from a public health perspective that this is the case, but we probably need to, or we could communicate it a lot more clearly.
And interestingly, Erin, our current piece of work for this year, or the 25-26 year, is looking at how primary care can be shaped out to 2035. So I think we've been thinking quite a lot about this as well. And again, going back to that point around how actually wellbeing outcomes are across a number of sectors. And this is something, for example, some of the people in justice that we talk to about were very clear, that they understand the complex factors that result in a young person ending up in prison, for example, or, and that actually many of the things that need to be addressed are across all those different sectors. And if we want to have successful outcomes or government goals, we actually have to work together much earlier on to make sure that those are attainable, in fact.
Thank you. Is there any other questions for Peter and Claire? Please raise your hand if you wish.
Barry, just noting that I need to leave in just a moment.
Any final comment then, Peter?
No, just to say thank you very much for the invitation to have a little bit of sharing of our thoughts with you, to make you aware of the report. Please make use of it, everybody. It is there as a resource. It's easy to engage with electronically. And any further discussion and questions, both Claire and I really welcome that via email or other means.
Thank you, Peter. Great to see you again.
And thank you. I will leave now.
Okay.
Architect.
Okay.
Claire's got the baton.
I'm happy to stay on the line if there are any other questions.
Are there any other questions or comments that people have on the call? As Peter said, that if you have any follow-up questions, they are happy to look at those either through email or elsewhere. Well, oh yes, Chris.
Yeah, I'll just chip in again. How are we tracking internationally with other people's narratives around this? Because same's happening on the Indigenous Determinants of Health front. The OHO's involved in that. But how does this report stack up with what our cousins across the ditch and everywhere else are having the same conversation? I've been.
Well, it's interesting. Obviously, there's the World Health Report on health equity, which came out earlier this year. So that's and it was kind of reassuring that we did have some of the same common thinking around future challenges and things like that. I haven't looked that specifically at Australia. I mean, they obviously still have a focus on equity with their closing the gap policy. I don't know how well it's going. I think what we've seen globally is that in times of sort of economic austerity or swings towards right-wing policy, neoliberal ideology, then discussions around equity, let alone indigeneity and determinants of health is probably harder to surface. But I'd say that there's definitely across, and this is something again that our key informants talked about, is that there's definitely much more awareness in the public space around the things that make up well-being and the importance of non-health care for health and well-being. And I think that as we go forward, it's really important in the public health sphere to keep that in the forefront of what we're talking about. That we are out there to advocate for, the things that make a difference to our society's health and well-being, and that's not just hospital medicine.
Thanks, Chris. Any other comments, questions, or just for Claire now? Okay, and well, thank you. And Patrick's just posted that there is a recording video of this, and it will be on the FONS website. So Claire, thank you on behalf of FONS. Thank you, and Peter, for giving up your time and giving the insights about how the report was put together and your thoughts for the future. Before I hand over to Tim to do the closing karakia, just a couple of announcements. There'll be at least two further FONS webinars later this month, one from colleagues in the Australian Institute of Health and Welfare talking about their screening programs, and there'll be a follow-up webinar on the census decision that we had earlier in the year. But thank you once again, Claire, and also pass on to Peter. A great discussion and presentation. Tim, over to you.
Ngā mihi, thank you, Barry, and thanks, Claire and Peter. Me karakia tātou, kia whakatau te tapu, kia wātia Aotearoa, kia turuku whakatau e, kia turuku whakatau e, hui e, tai ki e.
Kia ora.
Thank you, Tim, and thank you, everyone. Look forward to you at the next FONS webinar.
Kia ora, Barry.
Thank you.